Hi, my name is Dr. Carolyn Rodgers, and today I will be presenting to you HIV and its progression to AIDS. Today's presentation objectives include me defining HIV, identifying the symptoms of HIV, discussing global concerns for HIV, identifying who is susceptible in the US for HIV, discussing how HIV is treated, and identifying what you can do to help. So the question that we always like to ask is HIV a global public health issue? And the statistics that I'm going to present to you today will definitely prove to you that HIV is a global public health issue. Just listen to some of the things that I'm going to state. In 2020, 680,000 people died from HIV-related causes globally. Also globally, there were approximately 37.7 million people living with HIV. And currently, 84% of people with HIV know their status. And in order for us to reach the target of 90%, an additional 2.3 million people need to be made aware that they are infected with HIV. And that is an alarming number because that means those individuals unknowingly could be spreading HIV from person to person. 1.5 million people were newly infected with HIV in 2020. But since 2010, new HIV infections have been reduced by 31% when it was at 2.1 million. So that is a good thing because that means that we have actually been doing some good public health awareness pieces with community members that we've actually reduced it to 31%. But there's still individuals that we need to reach to reduce it even further. So who is susceptible in the United States for HIV? Well, one of the things that I want to do first is give you some of those characteristics for individuals who are actually living with HIV within the United States. What we'll find is that 75% are male, 23% of persons living with HIV are female, 2% were transgender, 46% identified as heterosexual and straight individuals, 42% identified themselves as lesbian or gay. And if we look at this by race and ethnicity, again, they look just like you and me. 42% were African American or Black, 29% were white, and 22% were Hispanic or Latino. Excuse me. So what is the prevalence here in Illinois? Well, there's an estimated 45,000 people living with HIV or AIDS in Illinois alone. And again, this shows you that this is a public health issue. So what is HIV then? Well, HIV is the human immunodeficiency virus. It's an infection that attacks the body's immune system, specifically the white blood cells called CD4 cells. And those that have been diagnosed with HIV typically go through 3 stages. The first stage is the acute infection stage. And this is where the person is most infectious, okay? In other words, they can spread the disease from person to person. Not contagious like a person that coughs without covering their mouth and making the virus airborne. No, but through bodily fluids when a person comes in contact with an infected person's bodily fluids. And we'll get into those, what those are a little bit later. The second stage is the chronic infection stage. Now notice at the first stage, this is the acute infection where the person is most has most infectious, where they can actually infect others, right? But they may not look sick. They may be asymptomatic. And as a matter of fact, many individuals with HIV during the first and second stage are in fact asymptomatic. They look and feel fine, which is the reason why it's very important for a person to get tested so that they will know their status. So as I mentioned, the second stage, which is the chronic stage, a person typically is asymptomatic here. They don't even know that they have HIV because they feel and look healthy. There used to be a stigma around people not wanting to take a test to see if they were positive for HIV because there was also stigma around it. And the stigma was that a person would be considered nasty or dirty and all of these different things. And that's just not true. You can look and feel perfectly fine and still have HIV. The third stage is AIDS. And this stage is basically where a person progresses from HIV to AIDS, and it has to do with their CD4 cell count dropping. And I'll get more in detail into that a little bit later. So what is HIV? HIV, it destroys these CD4 cells, right? Well, the CD4 cells, those are cells that work to help our immune system. But if we have a lower number of those cells, that means that our immune system is constantly being depleted. Okay, so it weakens a person's immune system against opportunistic infections. The common cold could be seen as an opportunistic infection. Tuberculosis, an opportunistic infection. Fungal infections, an opportunistic infection. And several bacterial infections, opportunistic infections. Some cancers, opportunistic infection, because the immune system or the person is immunocompromised. And so that allows the opportunity for other infectious diseases to then come into the person's body and to further overtax that person's immune system, okay? So if HIV is not treated, it can lead to AIDS, which is the acquired immunodeficiency virus. AIDS diagnosis only occurs once a person's CD4 cell count drops below 200 cells per milliliter, or if they develop other opportunistic infections, because developing another opportunistic infection will for surely take your CD4 cell count down below 200 cells per milliliter, okay? And so that's important, but it's also important and the reason why people need to get tested to know their status. So what are the symptoms of HIV? Well, some people may not have any symptoms at all. They may look and feel healthy. Again, they look just like me and you, because anybody can become susceptible to HIV if they come in contact with bodily fluids that I'll mention later on. So for many people with HIV, they can look and feel like influenza, which is also known as the flu. Those are the symptoms that they may experience. And those symptoms include a fever, chills, rash or rashes, night sweats, muscle aches, sore throat, fatigue, lymph nodes, mouth ulcers. And then again, some people may not experience any symptoms at all. And so you'll hear me say this over and over again. That's why it's important to get tested, so you can help stop the spread of HIV. How is HIV transmitted? Well, again, as I mentioned, coming in contact with an infected person's bodily fluids. Well, which bodily fluids are we talking about? Well, we're talking about blood, semen, vaginal fluids, breast milk. Those 4 bodily fluids are what contains the highest level of HIV contaminants that can spread from person to person. So an example of how HIV can be spread is through some of these risky behaviors, right? Having protected sex. That means that you did not wear a condom. right? That could be orally, vaginally, or anal sex. Sharing needles, right? Again, coming in contact with blood, semen, vaginal fluids, or breast milk, one of those bodily fluids. And in the case of sharing needles, it would be coming in contact with blood. Getting tattoos with used needles, okay? Again, coming in contact with blood. Drug injection with unclean needles, coming in contact with blood, and much, much more. Even a pregnant woman who's giving birth to her baby could also spread HIV from mother to child through the birth canal if that baby comes in contact with her blood and has an open cut or wound on their body, okay? That's another way that it could be transmitted, or through her breast milk. So how is HIV treated? Well, HIV is treated with antiretroviral therapy, also known as ART. ART involves taking a combination of HIV medicines daily. ART is recommended for all persons diagnosed with HIV because it helps them live longer with the virus by preventing HIV from making copies of itself to keep the viral load down. However, there is no current cure for HIV, and ART cannot cure HIV. Again, it is only a combination of medicines used to help the individual diagnosed with HIV live longer. So again, it's important to get tested so that you will know your status. Why is this a public health issue? Well, it's a public health issue because many people think that the HIV epidemic from the 80s has gone away. Also, if you know anything about the 80s epidemic of HIV, you know that there was a negative stigma around HIV and getting tested, okay? Many people believe that since there has been a huge medical progress, they often do not take the necessary precautions to reduce the risk of transmission, which is a terrible mistake to make because, again, there is no cure for HIV. ART medicines are only there to help a person live longer, but it cannot prevent the spread of HIV, okay? There is a new generation also that needs to be educated about the risk for HIV. And as I said again, there is no cure for HIV. So with that, please get tested to know your status. Now, what can you do to help stop the spread of HIV? Well, increase awareness of HIV in your community using this presentation or the information you've learned in this presentation. You can educate your friends and family about HIV from the information you've learned in this presentation or by sharing this presentation. You can promote safety precautions to prevent the transmission of the disease. Again, by using the information you learned in this presentation or by sharing this presentation. And please get tested. Get tested, get tested to know your status. For more information, you can use public resources such as the Centers for Disease Control, their online link at www.cdc.gov. And you can also use hivinfo.nih.gov or call them at 1-800-448-0440 for more information. I hope you've learned a lot about HIV in this presentation, and I hope you will get tested to stop the spread of the disease.